So tonsils, adenoids, wisdom teeth, are they spare parts or not? This sort of came to me recently, and it just becomes a very common question in my practice. Oh, I've had my wisdom teeth removed when I was having braces, or my tonsils were removed when I was a child, and my adenoids were removed. And often people don't even know why that happened, or dentist said the teeth have to go, so they went. So I just thought to unpack this with a bit of a provocative topic. And I searched the anatomy books, and I did not find it anywhere that it said some body parts are spare and they can be removed. So turns out we don't have spare body parts. So why does it happen that it's so common for wisdom teeth to be removed, probably a bit more common than tonsils and adenoids? Why is it so? Well, first of all, let's talk about tonsils and adenoids, those things at the back of the throat. What are they? They are part of lymphatic tissue, and they are located at the back of the mouth. So if we were to open our mouth, we'd see the tonsils there. If we say a big loud ah, and the adenoids are sitting behind the soft palate, like you see there on the picture, and that's showing an enlarged adenoid. So we can't see them when we open the mouth, but they make it difficult for us to breathe through our nose. And why do we have these organs in the first place? Well, they are helping our bodies fight infections and viruses. So they produce antibodies, and they are sort of part of our immune system, we can say, and they have an important function in the body. So here, just for some education's sake, here we have the back of the mouth, and if you're struggling to see this, you take a mirror and like, where are these things? Or if you're just struggling to see them in a child, just get them to say a loud ah or yawn, and then you will definitely see them there at the back of the throat. So we have the dangly bit, the uvula, and the tonsils sitting on either side. And this is not a real picture. You will see that when they're enlarged, they sometimes look red, not always. Other times they just look big. I decided, for the sake of our audience, to not include any very graphic material of the tonsils at the back of the throat. It can pull people off sometimes. But basically they can be seen, and why is it a problem if they become big? Is because they can restrict the airflow, and there's sort of nothing as important for our body as taking the next breath, because that's how we continue living. So when they become big, they can make it especially difficult for us to breathe at nighttime, because we relax at nighttime, relax, the throat muscles relax, and the tonsils, when they're big, they have more of a chance of coming closer together, restricting the airflow even further. So how can you tell without looking into someone's throat that their tonsils have become big? Is whether is when they breathe in a noisy way at nighttime. That's not the only reason, but that's one of the reasons that may be happening. Or they're struggling with something called obstructive sleep apnea, which is a condition that interrupts people sleeping. So what is that obstructive sleep apnea that we're talking about, and how it can manifest? Doesn't always necessarily manifest with these symptoms, but these are common. So snoring in little children, that's not usually, typically not snoring, it's just a louder breathing. Gasping for air, snorting, and you'll hear periods of someone not breathing and then all of a sudden picking up their breath. Breathing through the mouth is a sign of, may be a sign of enlarged adenoids or obstructive sleep apnea. Restless sleep, sleeping in unusual positions, tilting the head backwards in the sleep, sweating at night, bedwetting for children beyond the age of diapers, waking up tired in the morning, or waking up, just trouble waking up, and being sleepy, irritable, tired. With children, a lot of hyperactivity symptoms come up as well when they don't have a good quality sleep. Essentially, this condition affects the quality of our sleep, and that's affects then the quality of our life during the daytime. And one of the most alarming things probably is people falling asleep at the wheel driving. So that's probably the most dangerous thing that can happen with someone with sleep apnea. What else? What are the problems? Why should we be worried about tonsils and adenoids? They can make it difficult for us to breathe through the nose. We can have nasal congestion with or without excessive mucus. When the adenoids are enlarged and inflamed, so when they're red as well as big, they can give us a sore throat, tonsil stones, bad breath that can come from the mouth and the nose or the nose. Tonsillitis, which is inflammation and pain in the throat, where someone struggles to swallow, eat and swallow. So what can be done? This is my favorite. So these are the problems. What can we do about it? And is surgery, is it really the only solution? And should that be the first solution? I don't think it should be. And it is definitely one option, but there are other things that we can do beforehand. So because tonsils and adenoids are lymphatic tissue, helping to drain that tissue can help reduce their size. And there's a few ways of doing it, but one of the best ways is getting our own tongue to work on squishing the tonsils and adenoids. Getting rid of bacterial biofilm, so similar to our gut, where we have the bacterial flora populating the gut, and when it's out of balance, it causes us digestive problems. Similarly, we have bacteria living in our nose and our throat. And when the bad bacteria dominate, we don't feel too good. So getting rid of the bacterial biofilm and making sure that those harmful bacteria are not overly populating that area of our body. Thirdly, or firstly, they're not in order of priority, they're just things that we can do to help heal our bodies. So third is rehabilitation of nasal breathing, so learning to breathe through the nose so that we use the first level of filtration, which is the cilia in the nose, for the allergens and the dust particles and so forth, that we don't use the tonsils as our first barrier to the infections entering the body and the pathogens entering the body. And that's not the only reason, but that's one of them. And generally reducing inflammation in the body. And that inflammation can be caused by diet, by stress, by breathing incorrectly. So all of these things contribute to the enlargement, but especially the inflammation of those tissues in the nose and the throat. Again, the medical pathway always has medications for treating these conditions. Sometimes they succeed, sometimes not. But again, that's something that people can do before they resort to surgery. And lastly, of course, there is the option of the surgery, which is a complete or partial removal of tonsils and adenoids. Wisdom teeth. I just thought the picture was funny because they're called wisdom teeth, but are they really that wise? Because they always cause problems, and there's this kind of drowsy tooth coming through the gum. So what are they? They're called the third molar, so that's that third tooth coming. When I point my cursor, can you see it? You can, oh, wonderful. So we have our chewing teeth. Well, most of our teeth can chew, but most of the teeth at the front are responsible for biting food off, and the teeth at the back are for chewing. So that's third molar there, the wisdom tooth. That they come later in life, in late teens or in adulthood, early 20s typically. They can be impacted. So that was Michaela's question at the beginning. They can be just growing into the side of other teeth, and that can become problematic for those other teeth. And they are the most common teeth to come through abnormally or be missing. And it's not extremely uncommon for people to be missing adult teeth, but those teeth, it's more common to have them missing. So the very germ of the tooth was never present, or it somehow died. So if we are lucky to have our wisdom teeth, then we have a complete set of 32 teeth, and sometimes wisdom comes with it and sometimes it doesn't. Okay, so why do they cause so many problems? Why is it so common to have them removed? Why do they push onto others and come as these bullies, trying to push others out of their place? And if you ask the dentist, they'll say, well, it's because they're impacted. So damaging other teeth, growing sideways, like you see on that picture, where the wisdom tooth is starting to damage, well, it has damaged the root of the tooth in front of it, the seventh molar, the seventh tooth, the second molar. Other reasons that people that come and see me so they had their wisdom teeth removed is for orthodontic treatment, is to straighten other teeth, to make room for other teeth, so to speak. Or their dentist says, because there's not enough space. And another reason I didn't write here, but I have heard it, is because it was time to have them removed. But yet the anatomy book didn't say that those body parts are spare. So why? Why is there not enough space for them? And the answer is the short answer is simple, and it's incorrect craniofacial growth and development. So there's a lacking in growing of our face in a forwards direction. When our face grows correctly in the forwards direction, when all of the factors that help us grow and develop from a baby into a child, into an adult, when all of those factors are favorable, then we grow a long enough dental arch to fit those molar teeth, those third molars at the back. When something down the line of that growth didn't go quite right, that's when the wisdom teeth are struggling to fit in and starting to grow sideways, because they're just finding place where they can erupt. I'm going to try and play a video. I don't know how this is going to go. I haven't done it this way before with Zoom, so let's try. It's only for a minute. It's not specifically about wisdom teeth, but it's just helpful in understanding the whole concept. So let me see if it will work.
Can't see anything, Janna.
Oh, okay.
It may just be a matter of when you share your screen, maybe it's opened up in another window instead of the PowerPoint.
What about now?
Yeah, good.
Yes.
The audio hasn't been set up.
Now you can't hear it?
No. When you go to share your screen, before you go to share screen, there should be a little checkbox at the bottom that says optimize video for share screen. Try share screen again for this window.
No?
No audio.
Doesn't work? Chantal?
Oh, sorry. No, I thought I wasn't muted. No audio. Let me just see. Audio settings wouldn't be anything now. I'm just going to go through my settings and see if it's something in the meeting settings.
Can you see the video, but you just can't hear the audio? Is that right?
Yeah, that's right.
Well, how about I just talk through the
What's going on?
talk through the video? Is that okay? So basically, it's explaining how the tongue is supporting the growth of the roof of the mouth and the top jaw when it's sitting in the top jaw. When the tongue is low in the mouth, whether because of mouth breathing or some oral habits or like thumb sucking or incorrect oral function in any way, it limits the growth of the top jaw. And then the bottom jaw also is behind in growth. Can you see this, the video? Yes, Chantal? Yeah. So it's just, if you can't, but you can't hear it, yeah? So it's just explaining how the top jaw narrows when the tongue is not sitting up in the roof of the mouth. And you see the narrowing of the teeth there. No, should keep going. So the top and the lower and upper jaw become underdeveloped and they shift backwards, which limits the size of the airway, which is a space through which we breathe. That didn't work very well, but anyway, we have to figure out why. We have to figure out why.
Yeah.
Okay. So for me to share the, okay, I'll just come back to where I was sharing. Okay. Can you see my screen now?
Yeah, perfect.
All right. So, I mean, the images here, someone could debate that it's genetic and of course there are genetic predispositions. But when we have correct oral function, our facial growth is directed in a forward direction instead of a downward direction. So you see the top two, went backwards. The top two images, how those bones are growing sideways. So the cheekbones are wider, whereas the cheekbones on the lower, with the lower man, are narrower. And you know, this is obviously not a real person, but in the field of craniofacial growth and development, there are studies on identical twins, and you can see how that's probably the most amazing, amazing proof of how people that look identical at the start, and one of them develops an allergy, they can't breathe through their nose, and then the whole spiral starts of them not being able to breathe through their nose, or their tongue sitting low, and then their face not growing properly. So our muscles direct the growth of our face, and those muscles are mainly the tongue, the lips, the cheeks, and the way that we breathe affect how we grow. Okay. And how do we know this? Like, how do we know for sure that this is the muscles, and how come beforehand there was no problem with wisdom teeth? There was no dentist, by the way, either really in those days, where these skulls have come from. So we have studies. Some of them date much earlier than others. Weston Price is a famous dentist who studied nutrition, and he wrote a book called Nutrition and Physical Degeneration. And he looked at ancient skulls, but he also looked at primitive diets. And his hypothesis was that the way that we eat, and especially the lack of chewing, the lack of hard foods for chewing, has impacted how our faces were growing and developing. So he found whichever populations that have moved from their original villages or places where they lived to cities and changed their diets, they started developing crooked teeth as well as tooth decay. So his work is mainly famous because of tooth decay, but he also looked quite closely at how faces grew and developed and malocclusions. And he, as a dentist, he attributed it a lot, not only to dental hygiene, but to nutrition in most. So we have the study come out this year that was really interesting, and that talked about the modern the study in primitive skulls and how there was always 32 teeth present and room for them. So there was never, impacted teeth were very rare. I'm seeing there were some questions in the chat, but I actually don't know how to come back to the chat. So I'll come to that later. We're almost at the end anyway. I don't want to go for a long time with a presentation. So what can we do? What can we do to make sure our wisdom teeth fit in, not so much for ourselves anymore, but for the generations to come? Breastfeeding is one of the things that help babies grow their jaws properly. Nutrition, and that's eating real and minimally processed food, and most importantly, enough chewing in our diet. And chewing helps growth. I don't want to go into detail of how exactly that happens, but that's something that's sort of consistent in the research. Oral habits, and that's that can be pacifiers, thumb sucking, finger sucking, just poor oral resting posture, mouth hanging open. Breathing, so that's mouth breathing, typically that would cause that underdevelopment of the jaws. And so we want to breathe nasally, and we want to breathe functionally. So ensuring correct oral resting posture and correct oral function. And that's from birth and childhood. But what if I just find out about this now, like, and I'm an adult? What do I do? So there's lots of things that you can do to improve the oral function, and it doesn't mean your wisdom teeth will all of a sudden fit in, especially if they are impacting other teeth. But it's a way to help improve how the whole area of the face and neck functioning. So it's orofacial myology, which is also called orofacial myofunctional therapy, and that helps our muscles in the mouth to function how they should be for speaking, chewing, swallowing, resting, breathing, and so on and so forth. Making sure we breathe correctly, and if it's a child and they're not on track with their dental development, there's always things that can be done early, and that's always a lot more effective than what can be done for adults, although things can also be done for adults at almost any age. It's just harder because we are not growing anymore, but there is still development that can happen with certain techniques and certain forces.